we had other great speakers who have been on this dais, and it was well appreciated by many. And gradually the numbers are increasing. The interest in spirituality is increasing, and the role of spirituality in related to mental health and psychiatry is increasing as well. And today we are in another edition of Friday Awakenings. And today we have our esteemed chief guests, Dr. Vijay Kumar from Chennai and Dr. Bruno Paz Masquero from Brazil. And our eminent speaker today is Dr. Shubhangi Pakar from Mumbai. And before introducing the speakers and the speaker and the chairpersons, I would like to introduce Dr. Avdesh Sharma ji. He is our chairperson for the Spirituality and Mental Health Task Force of Indian Psychiatric Society. Can we have Dr. Avdesh Sharma ji's slides, please? Dr. Avdesh Sharma ji is a chair of World Psychiatric Society on Religion, Spirituality and Psychiatry now. He has been the international lead on public education for the World Psychiatric Association, advisor, Spirituality and Mental Health Task Force of Indian Psychiatric Society, International Distinguished Fellow of American Psychiatric Association, past president of IAPP and IPS, North Zone and Delhi Psychiatric Society as well. He is the founder member of Indian Association of Biological Psychiatry. It's very interesting. And Indian Psychiatry of Bipolar Disorders. He is the founder, Mind Vision Enterprises and managing trustee, Rahat Charitable Medical Research Trust. He has done several television series on psychiatry and spirituality as well. Man Ki Baat, Mind Watch, Mind Your Mind. He had done several workshops on stress, self and mind management. He had more than 1,000 presentations on spirituality and mind-body connection. He is the co-author of several books, including Distress to De-Stress and Couples in Harmony. He is also a recipient of Gem of India Rashtriya Gaurav Award and T.P. Jhunjhunwala Foundation 24th National Excellence Award for Medicine in 2014 and Health Oscar Award of India in 2017. And just recently, he also has received an award. Can we have that slide? I think this will be introduced by Dr. Rajesh.
Nareshbhai, you may continue, please. That's okay.
Okay.
Sharbari, can we have the next few slides for Dr. Sharma, please? Yeah.
Yeah. So has received the India's Top Minds Awards. That is recently in 2021. The brand stories India's Top Minds 2020 and 2021, and his certificate is proudly presented to Dr. Avdesh Sharma ji, chairperson of Spirituality and Mental Health. And this award is mainly by the Indian Brand and Leadership Conclave, which has occurred recently for this year. And this is a very prestigious award received by, I think probably he's the first psychiatrist in India to have received this award. So congratulations, sir. So I'd like to introduce Dr. Avdesh Sharma ji to say a few words for this.
Okay, thank you, Dr. Naresh.
The presentation when he has received this award.
I think somebody's mic is open, so there's a lot of sound coming. Dr. Vijay Kumar and Dr. Hina.
I think we are hearing you a bit low, sir. Can you be a bit loud?
Yeah.
Avdesh Sharma ji, you can continue to speak.
Okay. So first is that, it's always been a privilege to be a part of this group. And maybe because I've been chairperson for too long in the group, that's why Naresh keeps referring to me as the chairperson of this section. I'm not. Dr. Rajshri is. I'm just an advisor. But it's fun to be so, because it's such a cohesive group that there are no hierarchies. Everybody is so easy with each and everyone. And I was just thinking that the issue that we are discussing today, and having none other than Dr. Shubhangi, whom I have been knowing for about 40 years now, I've done many things together. The fact that we lose 8 lakh people to suicide, completed suicide, every year. And probably 10 times more attempts are made. And about half of them actually end up as some kind of a temporary or permanent loss, physical or mental, not only to the individual, but to the entire family. If your bread earner is gone in young age, you can understand the kind of impact it would have. And last 1.5 years have been very, very tough for people because their studies are disrupted, their jobs are disrupted, whatever work they were doing, that hasn't happened. India and China, 50% that's due to suicide. In terms of the number of people we lose to suicide. So it's not a small problem for us. But what is important is to realize that in last about 20 years, as Dr. Naresh was saying, many aspects, the so-called soft aspects of life, like hope, like connectedness, like having a purpose in life, like altruism, like doing things for the society, etc. These are coming up as big factors because in mainstream psychiatry, we start treating after a person has attempted, whereas what is required is to prevent it, prevent an incident from becoming depression and depression turning into a suicide. And I'm sure Dr. Shivangi today would be doing an excellent work of talking about these issues, and after which having these two eminent chairpersons, Dr. Vijay Kumar and Bruno, uh, and having very senior people like Dr. Ramanath and Tufanpati and Dr. Chokhani um, would be, I think, something we would learn from. And we are very fortunate to have them today as a part of the group. So thank you very much, Naresh. Please carry on.
Thank you, Dr. Abdi Sharma ji, for those wonderful words. And you rightly deserve this award. Can I have the chairperson, Dr. Vijay Kumar's slide, please? Right. Dr. Vijay Kumar is a distinguished psychiatrist practicing in Chennai. He has finished his MBBS from BJ Medical College in Pune in 1971 and finished his DPM from NIMHANS in 1975. He has more than 45 years of experience in the field of psychiatry. And he just mentioned that he's the first private psychiatrist in Chennai. He's currently practicing in Rajiv Hospital, a private multi-specialty hospital in Chennai, and Vijay Kumar's clinic zone, a private outpatient psychiatric clinic in Santhom, Chennai. He's the director of the Institute of Neurological Science, Voluntary Health Service, Adia, Chennai. He's also one of the founder trustee of SNEHA, a suicide prevention and crisis center. He was awarded the Lifetime Achievement Award by the Dementia Society of India during 2012 and Indian Medical Association Kodambakam during 2013. He has attended and chaired several national and international meetings. He has spoken and written articles on spiritual aspects of dementia. I would like Dr. Vijay Kumar to say a few words on this occasion. Welcome.
Thank you. I would like to start by remembering Vijay Sharma. I think several years back, somewhere in 70s when he started practice, I remember, Avdesh, I'm sure you'll remember, you came into Chennai to do a video recording of all the practice setup that I had. You know, you visited Santhom Clinic, Raju Nursing Home, VHS, and had a complete video listing of my practice. You also probably would remember that your wife was in a training and internship in the Department of Psychiatry at VHS at that time. You were not married at that time, but I'm sure you'd remember. Things are all the same. In fact, all the centers that you visited and took a video, they're all existing, except I got married to Lakshmi in 79 and 84, 85. She actually actively went into suicide prevention. And 5 years back, my son took up psychiatry and he joined me in practice with specialization and addiction. Things are just the same, and it was nice seeing you today and listening to your talk after so many years. Now, with that introduction of familiarity, I would like to start on the concept of spirituality. This is the first meeting of spirituality that I'm attending, though I have been the chairperson in the last 1 year. I was the chairperson in spirituality and psychiatry. And I want to start off with the concept of spirituality. What do you mean by spirituality and mental health? What happens is, in spirituality, most of us believe that we are the body and mind, and we forget that we are the spirit that is residing in us, which is responsible for our functioning. It's like the electricity which gives current to all the electrical gadgets. We can't give importance to the electrical gadgets without the source power. Without electricity, all the electrical gadgets will be useless. So our body and mind is really useless without the source power of consciousness. This is what I would like to emphasize. And what in mental health is important is that we grew up with a lot of conditionality. We are conditioned, and we still have a lot of responsible figures like our parents, like our close relatives, the voices inside us almost controlling our lives. We have always been made to feel us, thinking that that is what is going to give us happiness. Chasing happiness outside constantly makes us chase and makes us at some point very unhappy. It's only when we encounter great illnesses or really near death that we start realizing what is the purpose of life. What is all this drama about? Only then we start questioning the purpose and who we really are. Now, I thought I should now, with this introduction, tell a few people who have helped me in my practice to apply spirituality in mental health. One of the persons that has helped me was Byron Katie. I don't know how many of you have read her books. The most important book is Loving What Is. Now, this is actually a person who developed depression in the USA, and unfortunately, American insurance didn't allow her to take real psychiatric treatment because the insurance didn't cover. So she was put in a rehabilitation center, and only that she could afford. Now, in that cellar, she was actually afraid of cockroaches, and that cellar was full of cockroaches. Now, it's like almost like a flooding technique. Byron Katie realized that it's the thought of the cockroaches that is more troublesome than the fear itself. The moment she handled the thought, she realized the fear dissolved. So from then, she started realizing it's the thought which causes the problem. And if we can handle the thoughts, the issue drops away. So she brought in the concept that thought, feeling, and behavior are all connected together. The feeling is actually like a Velcro, which is attaching the thoughts and the behavior together. The moment the feelings are dropped away by certain techniques of breathing and realizing, then what happens is the whole thought and behavior drops away. So she conducted workshops on treating a lot of problems, asking each client to write down what his thoughts were, what his feelings were, and how the behavior changed because of these sorts of feelings. So she conducted workshop, and in one sessions, she was able to resolve the problem. Now, what all that she asked was, is it true? 4 questions. Is it true? Is it really true? What happens if you don't believe this thought? What happens if you believe the thought and react to it? Simply asking these 4 questions made them realize that they have a choice of accepting the thought or not accepting the thought. No, it's like, in India is a country where we love cricket. You have what is called as a third umpire in cricket. Just imagine a batsman is getting out and he goes to the pavilion given out by third umpire. He is going into the pavilion, grumbling, saying, "I'm not out." You'll find his head shaking. But the moment he goes into the pavilion and sees the action replay, sees the ball has touched the bat or he has not touched the bat on the crease, the moment he sees that it is his mistake, he stops complaining and he accepts that he has made a mistake. Similarly, in this questioning of 4 questions, a person is made to visualize the whole problem, separate the thought and feeling, and the moment the person realizes that he has a choice of accepting the thought, accepting the belief, or not accepting it. Once he disowns the thought or belief, the whole problem drops away. So the patient is made to feel that freedom is free, suffering is a choice.
Thank you very much for those introductory words. We can continue after the speaker session. Let me take next chairperson, Dr. Bruno. Yes, he's a psychiatrist, brilliant psychiatrist from Brazil and a psychotherapist as well. Dr. Bruno is supervisor at psychiatric residency program at GHC Brazil. He has a master's and PhDs at the Federal University of Rio Grande do Sul, that is Brazil, studying the relationships between religiosity, spirituality, resilience, and depression. He is the chair of the Commission on Spirituality and Mental Health of the Brazil Psychiatric Association. He is the secretary of the section on religion, spirituality, and psychiatry of the World Psychiatric Association. Welcome, Dr. Bruno. We are extremely happy to have you on this session. Can you kindly say a few introductory words over this slide?
Thank you. Thank you for the nice words, invitation. Thank you, especially today when we are in the World Prevention Day for against suicide. And are you listening all?
Yes, yes, we're able to hear.
Yes. Okay. And I agree that we need to be especially concerned with suicide and look for alternatives and to prevent suicide and to deal with conditions that are very close to a suicide attempt, for instance, severe depression. And we know that worldwide, most people belong to religious organizations and are connected to some kind of faith or spirituality. And we also know that spirituality and religiosity they can provide us with resources to deal with suicide thoughts and attempts, and scientific evidences reinforce that that kind of association. We have high quality studies the last decades showing that religion and spirituality could be a very helpful resource to deal with suicide. So I think this is certainly an amazing opportunity to think about that, to share ideas about these topics, and to hear this conference today is certainly very nice. So these are some introductory words here from Brazil. It's very good to be here with all you guys from India, Psychiatry Society, and the task force. Thank you all for the invitation, and I hope we can learn together these things and to think about alternatives to integrate spirituality in our psychiatric care, mental health care, to help our patients that certainly benefit from those conferences and those actions and those kind of efforts. Thank you again for the invitation.
Wonderful words. Right. Thank you very much. Now I would request Dr. Vijay Kumar to introduce our speaker, Dr. Shubhangi Pakar.
Well, Shubhangi Pakar got her DPM and MD from Bombay, MSc and PhD from Switzerland. Ex-Dean and of Academics and of GS Medical College, former professor and head Department of Psychiatry, ex-chief Drug De-Addiction Center of Excellence, GS Medical College and KEM Hospital, Parel, Bombay. C. Barfati Award of IPS 3 times, A.V. Shah Award of IPS Western Zone 5 times, past president of Bombay Psychiatric Society and Indian Psychiatric Society Western Zonal Branch, started mental health helpline HITGUJ in Bombay in 2014, Marathi writer and published many articles in various newspapers and book. The famous book on in Marathi is one Vyashmukta Hauya and Pakshitil Apashavar Mat Kasi Karal. Received Savitri Bai Phule Pushkar of mental health work for a woman. Received prestigious Nav Shakti Sanman Shola Pushkar for state, many national and international publications, served in various subcommittees of IPS, member of the Mental Health Task Force, Maharashtra State. I'm sorry, I couldn't spell some of these words very well. I'm sorry.
No, that's okay, sir. That's wonderful for introducing our speaker today, Dr. Shubhangi Raghunath Parker. Now I will hand over the session to our moderator, Dr. Rajeshri Ray, to continue with the sessions, today's episode. Thank you.
Thank you, Dr. Naresh Bhai, and a very good evening to all of you from the Spirituality and Mental Health Task Force. Thank you all to the chairpersons and our esteemed speaker for accepting our invitation. It is a very important day, the World Suicide Prevention Day, and it is significant that we are able to talk together about spirituality and suicide. I think the question is not anymore like, whether spirituality has a role in prevention of suicide. I think we have gone beyond that. It is more than beyond established with hundreds of literature papers that there is a definite role of spirituality and suicide. The question now really is how it is important and where it's important and where we are making the mistakes. So that is what ma'am is going to be talking through today, integrating a very unique aspect of suicide and spirituality. Now, suicide as a means of escape, I'm going to sort of just try to touch a bit on our scriptures, which says it is really a cognitive error about who you are. It is like a total identification with the body and mind and immersion like in the melodrama of life. What happens when a person wants to commit suicide is they want to truly want a fundamental escape from an extreme suffering by simply taking one's own life, and they think that they can avoid the intolerable mental and the physical agonies that come with it. But perhaps the cognitive error in the thinking is very that, I am unique, I'm independent, that this is more important than the others in my life. So they forget who the other people are in their life. They think the suffering they are experiencing is due to the circumstances in which they find themselves. They find no solution to it. And the only way to come out or escape from this is death. But our scriptures tell us that, we are not really unique and individual. We have families, we have friends, we have loved ones, and our primary duty is to care for them. Pain is for everyone. Life is not a problem. There are just problems in life. So there will be suffering. It's not optional. We have to go through it. So there's no escaping from it. And the solution is not really escaping, but the solution is to orientate ourselves to the proper philosophical or the drishti, and then put this into practice and philosophy of teaching. So in a way, spirituality has a very, very deep meaning in promotion of life, in preserving life, in cherishing our lives. And I would request Ma'am Shubhangi to enlighten us this evening with her vast experience in this area and the hundreds and thousands of lives she has saved in her precious work. Over to you, ma'am.
Thank you. May I share my screen, please?
Yes, ma'am.
Right. Can you see?
Yes, ma'am. Thank you. Please carry on.
Yes. Okay. Thank you, Dr. Avdesh Sharma, Dr. Rajeshri, Dr. Naresh, all very enthusiastic and dynamic friends. respected Dr. Vijay Kumar and Dr. Bruno. I'm very happy that you are here. Right in the beginning, I must say that I don't claim to be absolute expert in the area of the spirituality and suicide, but both the subjects are very dear to my heart. Suicide because of loss of some personal friends and my students, and spirituality I was introduced to by Dr. Chokhani with Vipassana, Goenkaji's Vipassana, years back when we were going through tough time because of my sister's long chronic leukemic illness. And later, I took interest in Vipassana. I do that every day. It had changed my outlook to the life, and I'm more interested in Buddhism. However, with another sort of bad luck, I also learned Bhagavad Gita for a long time from a very nice teacher from ISKCON. And these are the important investment in my life, which taught me something more, which I am evolving with. I am learning every day. So let us talk about suicide and spirituality. Very important, quickly I will go to with the background of my topic. Religion and spirituality are important values to people worldwide. The relationship between this religion, spirituality and suicide is complex but less studied than in mental health. Studies have shown that religion and spirituality are associated with the decreased rate of mental illness in general. There are many reports on that. Some studies have shown decreased rate of suicide in religious population. Spirituality has been defined as the person's quest for understanding life's ultimate question and the meaning and purpose of living. I am including this at the background of my subject. A difficult entity to measure, and ultimately people themselves must define what spirituality means to them, because whether atheist, whether religious or non-religious, everybody has some perspective of spirituality, and people follow it individually. In fact, I would say there are as many dimensions of spirituality as many people there in the world. Religion and spirituality, religious traditions certainly include individual spirituality, which is universal phenomena. Each religion has its own distinct community-based worship beliefs, sacred texts and traditions like Bhagavad Gita and Quran. Spirituality is not necessarily tied to any particular religious belief or tradition. This is what we must take into account. Although culture and beliefs can play a part in spirituality, because even if it is a Hinduism, in culturally different people may have a different belief system, different way of looking at spirituality, and there is unique experience of spirituality. It also highlights how connected we are, spirituality, to each other and to the world. This is very important perspective of spirituality, which I learned in the Bhagavad Gita. The polarization of this concept has been challenged, as many feel they are intertwined and interdependent. Okay, what is spirituality? You know, a little bit in a conceptual way, range of spiritual beliefs and customs. It is personal experience may be different for each person. It helps to find higher sense of purpose and meaning in the things we value. This is very important. Okay, so that meaningfulness makes spirituality a very individualistic experience for a person. It conveys hope and healing in times of anguish and loss. That's where we are looking at suicide prevention. Okay, and it promotes us to connect ourselves, our inner self, others, and what lies beyond. Okay, this is a very important perspective. It is a give and take phenomena in spirituality. This is what I want to highlight. There is a reciprocity. This means that the giver and receiver both get something from what happens, that if you help another person, you help yourself. In fact, there is a nice message which is viral on WhatsApp, that whatever you do will return back to you. You know, it's a very nice spiritual message. Okay, many carers naturally develop spiritual skills and values over time as a result of their commitment to those for whom they care. This is very important. This is my personal experience too. Those being cared for in turn can often give help to others in this space, because in spirituality, there is a perspective which gets divided between giver and taker. There is a spiritual and psychiatry special interest group of the Royal College, SPSIG, which helps psychiatrists to share experience. It increases knowledge of this research and raises the profile of spirituality in patient care. This is a very important perspective. Understanding spirituality. Okay, religion. When we look at the religion, I mean, right from Durkheim to Morcellet, everybody has got a different opinion. It is integration, it is affiliation. The people criticize it, some people accepted it. But remember, because we have to understand religion when we talk about spiritual, what it contributes, it is the source of the suicidal agent. It is the suicidogenic agent. It is suicidostatic agent. It is agent against suicide, or some people believe it plays no role. And this is a very important paper I found and I was impressed. There are many aspects of the suicidal behavior in the religion. It is unacceptable generally to any religion. Maybe, in some exceptional cases like Sati, Salekna, that is being probably, I would say allowed, but there is no critical aspect about it. In Hinduism, it's a violation of code of ahimsa. Worst form of violence in Jainism. Buddhism do not condemn suicide. There are arhants who have probably got the equanimity of the mind in the position to understand the equanimous attitude. They probably can go ahead with sacrifice of their body. Christianity do not support suicide morally, and Bible had non-judgmental approach to suicide. Judaism considers suicide as a sin. Islam clearly forbids suicide. It's crime in Islamic country. As we go further, this is the sentence of Jean-Paul Sartre I like. Everything has been figured out except how to live in this world. This is a very important perspective when we look at suicide prevention. Spirituality and suicide, okay, it is overlooked area in both religious and non-religious areas. Majority research look in the religious dimension, and very few have looked at a broader construct of the spirituality and suicide. Mainly, most of the studies are epidemiological, mainly related to suicidal ideation, attitude, and death by suicide. Very few studies on non-lethal attempts. A very scale study on interventional aspect of spirituality in suicide prevention. Most of the studies are quantitative, unfortunately, because qualitative perhaps we will give us a broader perspective and validity about some of the findings. There is incongruity of the outcomes of this various study. It is complex and multifaceted construct. That's a very important, and that's the reason why we may need a multidimensional approach to study spirituality and suicide. This is a one article which I felt was very interesting. American Indians exhibit suicide-related behavior at rates much higher than the general population. Those with a high level of cultural spiritual orientation had a reduced prevalence of suicide compared with those with low level of cultural spiritual orientation. Okay, results persisted in this case. Simultaneously adjustment for age, gender, education, heavy alcohol use, substance abuse, and psychological distress, which is a very important consideration. There is a David Tracy who has spoken about rites of passage. It is more philosophical, and he talks about mental transitions happen during crucial period of our time. We talk about life events. Okay, it changes people, it changes our attitude, our views towards the world, how we deal with the world. Similarly, there are mental transitions. And what he says, suicide is a rite of passage which gone wrong. Okay, suicide is not rational, and there is a spiritual dimension to it. which we must need to understand. His theory, of course, is intriguing and interesting. And he talked about two things: first self and second self. First self is something which deals with our, it is not our priority, but we learn it first in the life by connecting to outside world about wealth, about prestige, about dislikes, about social status. And second self is the inner self, wanting to connect differently to the cosmos, to the spirit, to the world, to the meaning, to the purpose, to the value, to the higher self. And he believes that, what we need to do is connect these two things together. Okay, so this is where we really need to understand, our soul. It connectedness of both the first self and second self. In a simple word, connectedness of the ego and the soul. Okay, soul needs different connectedness and has transcendental origin. Okay, what does it mean? Higher origin. And this is a very important that we educated the mind and intellect so far, but we have not educated heart and emotions. This is a different language. Let us understand this language than a biological language of the psychiatry or the mental health language. And what he says is a very important. The paradox of modern day society is interesting. We have everything on the earth, we probably have all the services, okay, and but so many ways we are comfortable, though we are still beset with serious mental health problems and suicide. That's a paradox. We are going ahead, however, we are facing more grave problems in the arena of the mental health. So we are going through changes, biological and spiritual, in today's world. Look at corona. Okay, even in the corona we are looking at the biological changes, we are looking at the vaccines, we are looking at the different treatments, we are forging ahead in this modern medicine. However, nobody is looking at the spiritual aspect, and that is a very important consideration of generally when we talk about suicide prevention. Popular findings in general population, those identifying themselves as at least somewhat spiritual were significantly less likely to report a past year suicide attempt than those not identifying themselves as spiritual, which is very important perspective. The protective effect of self-identifying spiritual values may be mediated by the influence of social support. So we really don't know whether it is a direct spirituality which is protective, or the social support which is being achieved through the spirituality which is supportive. So I think we require a little more studies to understand this aspect. There is decreased suicidal behavior in people with increased measures of spirituality has been shown in several subpopulations. Spirituality may represent a way of coping with mental disorder, or alternatively, exploring one's spirituality may require a higher level of mental health. Okay, so that linkage again is a very important and interesting. We know psychiatric disorders like depression, like PTSD, schizophrenia increase the risk of suicide. Okay, and people, there is a one study which is people who were religiously affiliated were less likely to have lifetime history of suicide attempts in depressed inpatient. In contrast, some other study found relationship between religious commitment and completed suicide. Clinicians should be aware. That's what is my strong feeling of the important influence of social support in understanding the relationship between religion, spirituality, and suicide. Now, I'm just talking here out of experience. What are those risk factors of suicide? Let us not talk about psychological theories or biological factor. In a simple clinical language, hopelessness, helplessness, guilt, despair, horror of emptiness, need to escape anguish, which is a very important. Suicide is considered as a psychological pain, and that's why getting relieved from this pain ultimately culminates in suicide. Void at the center of being of the human, and horror of emptiness in the life. These are a very important perspective. When we talk to our patient, we start understanding, okay? The other thing is there is a self-hatred. We know Freud has spoken about it. It is retroflect anger, he said. But self-hatred leads to life is not worth living, leading to existential despair, which is a important consideration. Getting rid of psychological pain for many people, like in domestic violence cases, we have seen so many women with the domestic violence getting into suicide attempt or completed suicide. Sometimes it leads to external seeking of pleasure, which Dr. Vijay Kumar mentioned, and it complicates the life in terms of the substance use disorder, which we call as a chronic suicide. So we really have to understand the perspective of psychological pain in much more depth while we talk to the patient. When we look at the self-harm, it's a way of dealing with loneliness and conflict very pretty often. Okay, we have seen adolescents having difficulty in overcoming emotional turmoil, especially those who have suffered child abuse and they don't know how to control their emotions and they become reckless. That's the reason why perhaps we see that impulsivity in the suicide of the adolescent patient. Wound from cutting has meaning, a different meaning for adolescent, for a woman who is a victim of violence, because for a woman who cannot express or cannot retaliate that aggression, which turns inwards. And this is where we have to understand the context of the suicide. What is it conveying to us? Maybe it's easy to identify depression, it's easy to identify schizophrenia and giving medication, but there is a personalized meaning which has got spiritual dimension. And enslavement and desire to cut free is a very important aspect of self-harm when we look at the spiritual perspective. Let us look at suicide survivors and spirituality. They do well when they have the belief in afterlife, when they have belief in spiritual well-being. Okay, it is found that higher spirituality score, there is a lower grief score. They can deal with the grief in a better way. Some reported their spirituality increased after the beloved suicide. This is, yes, I mean, I have seen this in the clinical practice. And spiritual beliefs assisted in coping with the loss. I remember in my class, there were two women who lost their kith and kin with the suicide. And when Gaur Gopal Prabhu said that, the life continues, soul never dies, I think they suddenly become brightened. So I think somewhere we do have some kind of spiritual awakening, through the religious aspect. Spiritual aspect of day-to-day trouble, very important to understand. We need symbolic thinking and need for understanding of spiritual aspect of our troubles. We define health with the spiritual perspective, but we don't intervene with the spiritual perspective even in the grievous situation in suicide. This is a very important. Reality and spirituality have to interact with each other, which probably we have to train a person. I think I have learned this perhaps in the Vipassana practice and in the Buddhist principle. Okay, and remember the psychodynamic. I feel psychodynamic looks at the soul and the cognitive aspect looks at the external aspect of the ego, and that's where again the spirituality need to be contributed to. This is a very nice sentence by Kate Horton. I like it, from the Comprehending Suicide book. I believe that the rule for saving a life in balance can, amazingly enough, be rather simply put, reduce the inner pain. When that is done, then the inner felt necessity to commit suicide becomes redefined. The mental pressure is lowered and the person can choose to live. A very important, because with the spiritual background intervention, I feel we have to look at those inner pain, all those emotional aspects of inner anguish. What spiritual skills give? Being honest and able to see yourself as others see you. I mean, there is no dramatic dimension about it. You understand that this is what I am, this is what I'm short of, this is what my weakness is, this is what I have more. Being able to stay focused in the present, to be alert, unhurried, and attentive to the life's business at that time, which is very important. Okay, being able to rest, relax, and create a still peaceful state of mind. This is very important because all of us have gone through the grief time, to the loss or relative loss, and we really need to understand this ourselves as a professional. Developing a deeper sense of empathy for others, which is a very, I mean, every religion says so. Finding the capacity for forgiveness, because that probably reduces all those emotions which are, creating havoc in our mind. Being able to be with someone who is suffering while still being hopeful. This is important. Spiritual skills inherently give us hope, which is required in the suicide. Okay, that is the probably the whole idea, in suicide prevention, giving them hope. Learning better judgment, for example, about when to speak or act, and when to remain silent or do nothing, and when to, not get agitated. All these aspects, are very important, because in suicide, there is a loss of judgment. It is a personalized loss of judgment. It is a loss of social judgment. And that's where spirituality comes here, to re-recognize the judgment. Learning how to give without feeling drained for caretakers, which is a very important, because all of us get into that business. Even as a psychiatrist, when we deal with the suicide, when we deal with the depression, we do get drained, and we have to probably give without feeling drained, and being able to grieve and let go. It's a very, very important perspective of spirituality, is what you can let go, let go. Okay. What spirituality offers? Patients say that they gain better self-control, self-esteem and confidence, faster and easier recovery. This is very important, often through healthy grieving of the losses and through recognizing their strength. I have personal experience when there were days in a year, 3 days in a year, at home, when you are losing your sisters. I had trouble time. I had absolute trouble time, with my attention loss and with higher position. Something definitely helped me was getting involved in these spiritual experiences. Okay, it helps in the better relationship with self, with others, and with God, with creation, with nature. Remember, this better relationship helps us, in overcoming the guilt, overcoming the feeling of not able to do well in the life. There, we start being a little more compassionate with self, which is important. A new sense of meaning, hope, and peace of mind, which all like. I mean, I like when I listen to Anapana every day. Goenkaji's sentence start with that, who doesn't want peace of mind? I think it just captures the attention. And this is what I'm hearing for years every day. This has enabled them to accept and live with continuing problems, or to make changes where possible. I think we can't throw problems away from us magically. We have to live with them. And when we live with them, how comfortably we live with them, what changes we can bring. And self-responsibility is a very important. Modi ji talks about Atmanirbharta. I think in spirituality, there is a base Atmanirbharta, which we probably understand our responsibility to ourselves. We are self-reliant, and we take the decision in that direction. Okay, what are the minimum things required in the spirituality to prevent suicide, love? That's what we have seen with Mother Teresa and so many people. Joy in helping people. It is not only appreciated between religious prophets or Hinduism, Judaism, Muslim, but anonymous common people also believe in this joy, helping others. This is very important. People who are happy about their lives have some simple soulful requirement. This is what I strongly believe, because spirituality gives the inner resources which help us at the time of crisis, when there is no external help, when there is no external support, when there are minimum worldly needs. I think when we have minimum worldly needs, there is less scope, less chances of getting frustrated at the drop of the hat. Okay, the stable relationship. Most of the suicide, generally, and in the adolescents, in the youth, are because of the broken relationship. Okay, this is a very important aspect to understand. There is a breakdown of emotion rather than the physical breakdown when there is a broken love affair. I have done this in my college, dealing with the children, and this is very important, that through spirituality, what we develop is a stable relationship and community involvement. I think, Ratan Tata, who keeps giving the world, basically, I feel there is a spirituality in that. You get, but you give a lot to the people for their use, and this is what the spirituality means. Okay, so these are the references of the spirituality at attempted suicide. Some of the best references. I think people probably can go through Bhagavad Gita. That's my favorite, and I'm very happy that I have learned it from a great teacher who simplified it. And these are a very important perspective. I thank you here. This is what I wanted to say. uh, there is this sentence which I like. The key to getting beyond your struggle is making choices that invite new possibilities. We must need to see new horizons, new ways of thinking, feeling, behaving, and living your life for the better. I think this is what perhaps spirituality takes us, from the depth of the earthquake of suicide, and we can still live a good life, a better life, enhanced life, rich life. Thank you so very much.
Thank you, madam. That was a very significant, it's a beautiful journey, how you explained with starting with the definitions of spirituality, your personal experience of learning the art and science of spirituality through the scriptures, talking about the psychological pain that comes with it, and the reasons why suicidality and spirituality are so very interlinked, finally to the spiritual skills that we could actually use in day-to-day practice to help our patients. And of course, alongside, of course, which we want to discuss as part of the final part of this webinar today evening, talk about the family, there's carers, support, it's after the end of life, maybe, we need to talk about how spirituality can help the people out afterwards. So thank you for a beautiful presentation on this World Suicide Prevention Day. We are having a few questions coming in the chat box, but before that, may I invite some comments from our esteemed chairpersons. May I start with Dr. Bruno from Brazil? Sir, would you like to give your special chairperson's comments after Madam's talk? Over to you, Dr. Bruno.
Thank you very much. Thank you, Dr. Parker, for your wonderful presentation, very comprehensive, showing us how spirituality can help in this particular problem of suicide, giving us scientific evidences, quantitative, but also trying to understand how spirituality can help us in a clinical practice. And I was thinking during the presentation that certainly we need to have more research to learn how spirituality promotes this mental health protective effect. But a key issue, I think we can give another step, is how to translate this knowledge to prevention efforts and to public health programs. And I think a dialogue with religious and community leaders might be another possibility to learn us from mental health care professions, to learn with spiritual traditions, and to share our knowledge of science and mental health resources. This dialogue might be a highly valuable thing we should think about. And the other issue is about medical education, how we can translate this spiritual knowledge and evidences to medical and healthcare professions of graduation, and especially in psychiatry, to bring these resources to our patients in the assessment, in the treatments, when we get severe depression episode, and addiction also is something quite related to suicide, how we can bring this knowledge to medical education. But thank you again for your wonderful presentation and for the opportunity to share some thoughts about these topics.
Thank you.
Thank you, Trudeau. And may I request Dr. Vijay Kumar, sir, now to give his chairperson's remark.
I think we had an excellent presentation, and the last slide, I think, speaks everything. You know, ultimately, it speaks about new ways of thinking, feeling, behaving, and living a life, a better life. You know, it's basically looking at mindfulness and mindfully looking at your life. And then also mentioned very beautifully on why less of research is coming in spirituality, because it's more a subjective feeling. It's very difficult to objectify. You know, this self, as she rightly pointed out, there are two selves, outer self and the inner self. And the inner self is more a subjective feeling of, you know, you can have more of satisfaction scale, more of scales of contentment, happiness, joy, and peace. You know, it's very difficult to quantify these things. So I understand, I think, why many of these research is not happening now, because of the subjective nature of this spirituality. I think an excellent presentation, and the last quote she ended speaks it all.
Absolutely, sir, because, you know, when we seem to be stuck, you know, and there's no escape route, there is always a route. We only try to find the older ones. The whole principle of thinking and changing the attitude is to find a new way to escape. You know, not thinking you're stuck in the maze, but finding a novel way, that ma'am wanted to say. May I now request Dr. Sharma to express his views on this particular topic following Dr. Parker's presentation. Over to you, Abdesh, sir.
First, Dr. Shubhangi, excellent presentation, because, you know, it brought in certain aspects which we don't hear of. We are all gotten so used to each one of us presenting the same material again and again, that after some time people also feel that it's getting recycled. But what Dr. Bruno and then Dr. Vijay Kumar spoke about, you know, I have a slightly different viewpoint here, and that is more from a public health perspective. Looking at the way the world is going, and looking at even 2021 itself, the number of different kinds of disasters, including man-made, including wars, including terrorism, which might increase, we don't know, including disruption of lives in one way or another, and for a large number of people not being very clear about the way forward. I think we are already seeing there are definite statistics show that people are becoming a little iffy about life, and there is a feeling that, you know, probably life is not worth living. What does make the difference for most of the people, for which we don't have to do much of, you know, prospective studies, double-blind studies. We need to, and I'll tell you how, is to start the process. And while you are going on with the process, then to have a study design within that process. The funding would be easier, number one. Number two, you don't have to go out and get a sample size and asking people, hey, have you felt suicidal at some point of time? And people may not even respond, but when they are feeling and they have come to you, then making them a part of that study while giving them intervention. The number of people who would be requiring that, and if they feel that it is not them who are requiring it, so they are not something different, special, or call it disabled, then help seeking would be easier. And the second is that we have to also realize that mental health professional, as we call them, you know, MD, DPM, PhD, etc., etc., we don't have enough. So we need to create a cadre of people who are there within the community and who can be trained very easily. Experiences in many of the countries in Africa, many of the countries in Asia, Southeast Asia, China, they have shown us that at probably 1/100th of the cost of training a medical graduate, you can ask people to pick up some basic symptomatology and tell them skills that they can do it in the community. And then one person, when they are trained, then others can follow suit. Maybe that is going to be the way forward for the future. We can't wait for next 20 years to increase the number of mental health professionals, by which time these numbers would have also gone up 20 times. Just a few thoughts.
Ma'am, would you like to say something on this?
Yes, you know what we have done in KM GS Medical College, we already started a department of medical humanities, for a long time now, 2-3, and there are programs on such a perspective, like, talking a simple concept of empathy, doctor-patient relationship, people, and this is organized by the student, because spirituality, pretty often we have got quite a good spiritual leaders to talk, the people around, and this probably can shape up, their mind right from the beginning. Otherwise, it is whole technological, whole biological, and we really, we have come through some kind of humanitarian crisis in medical field, where why doctors are beaten, why so many complaints. I think in such a situation we do need to get aspect of spirituality, the aspect of humanity, and this is what we have done. In fact, we as a senior people also get a lot of help from this particular perspective. We understand what's happening, what kind of process. So this is where we really need to go through and really start uplifting the whole medical education system. Otherwise it will be too late.
Can I just take one more minute, Rachel, in continuation of that? Harish,
Yes, sir.
last
Sure, sir.
1.5 years, this particular task force and the focus of the section on spirituality, religion and psychiatry at WPA is only focusing on this. Having free virtual conferences, people can join. If they are not able to on that day, they can listen to it later on YouTube and Facebook. I'm kind of opening the curtain, but many of you in the next 3-4 days will receive a letter. The Mental Health Foundation, Rahat Charitable Trust, which I manage, and AIMS Delhi, we are jointly with National Medical Council, of which Dr. Gangadhar is now the President for Ethics and Training. We are having a 3-day conference on interface of principles of spirituality. We are calling it the power of being. And we are introducing the concept of consciousness, apart from the concept of mind, in mind-body medicine. And in those 3 days, we will have 24 lectures, 2 workshops, which would be focused on these skills only: empathy, communication, the ability to connect with another individual, the ability to give, the ability to be able to give in short period of time, etc. Because these are skills that are not taught. These are skills that are given by your own example. So we are kick-starting the process, and maybe next year you will see many of the medical colleges, because it is aimed at undergraduate and postgraduate and earlier career physicians, that we would be teaching these skills, and these are all free of cost at this point.
A brilliant move always by Dr. Sharma in the right direction for everyone, So this is something that was much needed right from the undergraduate science. People need to talk about this more openly and without any feeling that, people will ostracize you. People will think that you're thinking differently. Let it be a part of our curriculum. Let it be a part of our general ways of talking. Let it be a part, an integral part of medicine. Only then we can do the best service to mankind, not separating or excluding each other, but being inclusive. I have, I think, there's a question from Dr. Ranjan. Ranjan, are you here, please? If you would like, there's not many questions in the chat box today. I think everyone's been mesmerized by madams and they just want to hear ma'am talk more. But Ranjan has asked a question. If you want to unmute Ranjan, and if you're there, because he's managing quite a few events today because we are having the Bengal Psychiatry Conference. Ranjan, can you hear me? Okay. If not, then there's a question is asked. Now, I wasn't sure what he was really wanting to ask. The question is, how long the structured or the unstructured sessions will be continued? Now, that's a question he's left in the chat box. That's why I wanted him to ask the question directly. Is anyone able to interpret that? Naresh bhai?
Probably the role of spirituality in prevention
Probably.
of suicides. I mean, are there any structured sessions, around 4 sessions or 6 sessions, or what is the content of those sessions or something like that? Probably that's what he mentioned. Or is it an unstructured sessions can go on?
That is what I wasn't. So anyway, ma'am, would you like to enlighten any, on this, please?
I'm not pretty sure about unstructured sessions because I think what psychotherapy, I am a CBT trained, so we generally take structured sessions only, and it is just a matter of how your client, because you have to connect with the client and help him the getting connected, to inner self and to the spirituality. So this will go on. Of course, it's not psychoanalytical perspective. It won't keep going long and long. It will culminate somewhere, but it will depend. For what are you dealing with? The identity crisis, substance use disorder, or depression, or the grief. And this is how proactive the sessions will be from the spiritual aspect. That is how it will go.
Sure, ma'am. Anyone would like to ask any questions for this particular session before we move on to our final part of generically asking people? Yes, sir. Dr. Sharma would like to answer something in specific as well to the previous question. Over to you, Dr. Sharma.
So you need to unmute, sir.
Okay. And what earlier on Dr. Naresh had said, to me, the question of sessions only comes in after he has stopped thinking about suicide. Because that's a sword which is hanging on your head all the time. When somebody comes and says, look, I think I should end my life, all your efforts are, let that not happen. You get other people in, you ask him to call you every day, you send him a message in between just to see that he's alive. Once he decides that, okay, life is worth living, then whatever the issue was, which was taking him on that path, that work starts. If it is a long time issue, if it is something which is interpersonal going on for years, and the person is living with the same person, then it has to be long term. In private practice, unfortunately, the issues about time, money, availability of person, therapists, etc. comes in. But there are now plenty of organizations, including what Dr. Vijay and Lakshmi are doing, Sneha. And there are many other such organizations who are willing to chip in. But I think the idea would be to keep the person motivated, to not only stop after the threat of suicide is gone, but to keep working at it so that it doesn't come back. And that may sometimes take 6 sessions, that may sometimes take 12 sessions. It may be sometimes longer, but I think only then one can say that, okay, for the moment, the threat is gone. Otherwise, we shouldn't rest easy.
Okay, if there are no, sorry, there's any other questions in the chat box? No. And yes, and in this time, during this time as well, Dr. Mosquero had to leave. So thank you to him as well. I think we have many of our seniors in the audience today evening. So Naresh Bhai, would you like to take over from here and request our seniors, Dr. Tufan Pati, Dr. Ramanan, and others to express their views? Over to you, Naresh Bhai.
Thank you, Dr. Rajeshri. I think, yeah, Dr. Tufan Pati sir, do you want to say a few words about today's sessions? So you need to unmute and then speak, sir.
So I muted and been listening to Dr. Parker and all the deliberations quite calmly. Thank you, Dr. Parker, for such erudite presentation and erudite explanation. As I believe, prevention of suicide by spirituality is an important aspect. Spirituality has an immense preventive aspect. Promoting a positive attitude towards life is itself a preventive measure against suicide. Counseling comes last. One is we attempt to prevent suicide, a person does. It is ineffective, person commits, successful, nothing to do research, why did he commit? Unsuccessful, we can counsel. But the basic thing is that we have to create an environment, and if we think utopically, we can have the world like this at some point of time, where spirituality will play a great role in having this place where people will have predominantly positive attitude in their life towards the world and at large towards the universe. That is the ultimate goal. Thank you very much, Dr. Shubhangi.
Thank you very much, sir, Dr. Tufan Pati sir. Dr. Ramanan Irat, sir, do you want to comment on today's session, sir? Welcome.
Yeah. Thank you, Dr. Naresh. It was an excellent presentation by my colleague, Dr. Shubhangi. We were together in Sion Hospital for DPM. And as always, she is a good presenter. I mean, she's a good presenter. And it was an excellent talk. This is the first, I think, talk I'm hearing about spirituality and, the psychiatry. It was an excellent presentation. I think rather than focusing on the medication, I think it's a sort of an adjuvant. The spirituality aspect also has helped many people. In fact, we sometimes use some of the verses in Quran and all that in certain patients where they talk about suicide and all that, because in Islam suicide is not accepted thing. So we can use such things in our day-to-day practice. For example, in Hindutva also there are certain things which are well said in Gita as well, as she was telling. So without going into the religious aspects, we can incorporate all these things into our practice, though it need not be very structured, but it can be used as a sort of a short-term psychotherapy also. I think it helps people also, especially when you don't mix religion with spirituality. It should be separated. I think it was a nice presentation. This is the first session I am hearing on spirituality. I hope I will be attending the next subsequent sessions too. Thank you, Dr. Naresh.
Thank you very much, Dr. Ramanan, sir. He's the incoming president of the South Zone Indian Psychiatric Society. And yes, this is the first session he's attending, and this is the fifth in the series. So probably we'll be having more. So we welcome him to the other sessions as well. We'll keep informing you, sir. But anyone else who wants to talk to or say a few words? Dr. Vijay Kumar, sir, do you want to say anything? No, okay. Whom do we have? We have Dr. Narasimha Reddy, sir, is there? Seniors or?
I can also say Dr. Chokhani.
Dr. Bhagya
I can see Dr. Madhu Juneja. I can see,
yes.
We can ask them because they are very experienced in these. It's just not their seniority, it's also their experience. And Suresh Kumar is there.
Okay. Anyone? Dr. Suresh Kumar, sir, Dr. Chokhani? No one else is there, or anyone? Okay.
Archana is here. Archana, if you want to say something. It's a Teach festival as well, so it's sort of,
Today's day about suicide prevention, the main theme, which was released by the WHO and the International Association of Suicide Prevention, is creating hope through action. And that kind of hope itself, I think the spirituality generates that kind of hope in a person. So, I mean, the goals of a spirituality, I mean, we say that it's a purpose of life. So if the purpose of life is defined, so it is different from every person, and then the individual person has to define his own purpose of life. And once that purpose of life is defined, so that kind of spirituality, he himself develops that kind of hope and then continues to live apart from, I mean, when we say the medical model of suicide, that is underlying psychiatric illness and the changes in the brain, and we have seen about in the last session about the neurobiology of suicide. So apart from that, so apart from medications, I think the changes that take place, I think the second session we had with Dr. Shivaram, who has discussed about the various changes that take place during the spirituality in the brain. I think that can bring about the changes as well, especially that kind of hope related to today's theme, right? So with that just brief speech, anyone else? Dr. Suresh Kumar is there. Do you want to speak a few words, sir?
Dr. Chokhani wants to.
Okay. You can unmute yourself and speak, sir.
Oh, yes.
Yes.
So, hello, everyone. I'm speaking from New Zealand. So it is going to be about 5 o'clock in the morning of Saturday here. So this is a very dear area for me, and that's why I got up at 3:30 at night to attend this from here. And like many of my senior colleagues have mentioned, I think when a person is actually actively suicidal, thinking of suicide, etc., then that would not be a time to teach or introduce the concept of spirituality at that time. If the person has already got some spiritual, some religious, some philosophical thoughts, then of course those thoughts can be explored and reinforced in helping in using them to keep the person alive and get this person out. However, if the person doesn't have those thoughts already in his psyche, then bringing those things as a new topic may not really be working. And I'm also aware that it's sometimes in certain aspects of religiosity or spirituality can also go the other way around. Some person may also be feeling that, oh, I am actually God is going to be angry with me because I've been doing this bad thing. For example, having depressive thoughts, guilt feelings, etc., self-blaming, etc. So sometimes also understand that these religious beliefs can also go against the will to live, etc. So I think religiosity, spirituality, they are much more complicated when it comes to individual assessment and intervention in an individual person who is presenting with any psychiatric malady, be it mild anxiety, depression, or more severe and presenting with suicidality, etc. So what I feel is that the greater role it has is like some of my senior colleagues mentioned, is in terms of promotion of health, prevention of mental ill health, etc. Because we know that in India, particularly, with this great scarcity of mental health professionals, psychiatrists, etc., counselors, psychologists, and also because of stigma, this far little attendance to mental health professionals to deal with their psychological health, etc. Its spirituality and religious traditions are a very good platform to help them psychologically understand and then promote their mental health, emotional health, and also prevent development of serious mental illness and suicidal ideation, etc. So in case they have that background, then when they do become mentally unwell, then it is far more likely that mental health professionals who have similar, who have some training in how to do a spiritual assessment and interventions, so they will be able to promote that as well. So I think this is an area where lots of people may have lots of comments. Lots of people would feel that they know, but I personally believe that it is a very sensitive area and requires very careful understanding and very tactful application when it comes to working with that individual person who is presenting with suicide. And it should not be taken so lightly that so we can just sort of first, like what we say, unless we fully understand where the person is in terms of his or her suicidality and spirituality, etc., whatever we do in terms of sermonizing the spirituality, etc., it's not really going to work. So thank you very much.
Doctor, finally, I'll leave it to the speaker. Do you want to say any concluding remarks, Madam? Dr. Shubhangi Pakar, Madam?
Well, it's a nice initiative. I am interested in basically spirituality. I use it in my practice. But as Dr. Vijay Kumar said, it should not be in the acute phase. We still have to look at the emotional stability. That turmoil has to be settled. And this is where, in the prevention perspective, in mental health promotional aspect, I think spirituality helps. But what is important is how you evaluate. We have not touched that aspect, but evaluation of the spiritual aspect, spiritual dimension, the personal meaning person has, I think we should be pretty serious about it. And then we have to get tuned to go ahead in the whole. We must find out what are their belief system. Are they already following gurus? And which gurus? Sometimes it may boomerang. So we have to be also correct in terms of scientifically correct in terms of following this particular path of the spirituality, because sometimes you say one thing and then guru says something else. So I think this kind of experience also is matters. We do have many people following some kind of religious ritual, some guru is there, and we know all about it. So we have to be careful, but it is helpful when it is used positively, carefully, and in terms of the enhancement. In prevention of suicide, I found it pretty useful. Yes.
Thank you very much. I think Dr. Chokani is there.
Chokani is raised, yeah.
And he has raised his hand. So, Dr. Chokani, sir, do you want to speak, sir? Dr. Chokani, sir?
I'm sorry, I'm not looking very presentable, because I'm not dressed up and all that. So I'll rather not put my video on, Please excuse me for that. And very great presentation, and the seniors also chipping in. I recollect my long association almost 15 years ago with Dr. Vijay Sharma, when he brought up that book, Spirituality and Psychiatry, sometime in 2009. And I'm to be very clear at the outset, I am more of a clinician than an academician. So it was a great learning experience going through Dr. Shubhangi's presentation. as if I'm looking at spirituality from a different dimension altogether, you see. So quite a learning experience for me. Only a couple of points I'd like to say. First of all, we should not be mixing up religion and spirituality. Spirituality is taken as the bottom line of any religion. You know, the essence of any religion: be good, do good. That's it. And for that, we need to, as therapists, I find very useful to be anchored in some sort of a spiritual being, spiritual base. It helps in two ways. It helps myself in the sense that I don't get so shaken up interacting with my disturbed clients. Because it does influence us whether we like it or not, consciously, unconsciously, in so many ways. And so we are able to help them better. Whether we subscribe to any religion or not, that's secondary. Spirituality is just being a good human being. That's why I compliment Dr. Shubhangi for taking the initiative of starting this department of medical medicine and medical humanities in AIM. She's done a lot of trend-setting work. I'm more of a Vipassana man than a psychiatrist. I'll be very frank with you, because all of my colleagues, I got introduced to Vipassana and then took up psychiatry. That okay, I want to specialize in medicine. Which branch shall I go for? So already being anchored and introduced to Vipassana, naturally psychiatry appealed to me, and I went psychiatry. So here two facets: crisis situation, crisis intervention, where the person is actually contemplating to kill himself or herself. That time, of course, our other psychiatry skills will get top priority. We have to save the person, bring him back to normality as fast as effectively as possible. But then, as I said, while in this situation, we need to help ourselves. We're getting so many cases of professional burnout, and here also it was mentioned, we feel drained, we are not able to cope up, we succumb ourselves, to various psychological distress, even disorders for that matter. Like our other medical colleagues pull our leg, oh, he's a madman, he's a psychiatrist. And some other people, some other colleagues will pass this remark. Okay, you need to match your wavelength with your clients. No wonder you are mad, so you can communicate with them better. All of us are familiar with all these remarks when we negotiate our medical career and postgraduate career. So to sum it up, spirituality has a definite role, provided we define spirituality very clearly and not get mixed up with so many religious approaches. This is the only life, no afterlife, soul. We are very sure about mind, body, and that's what Dr. Avdesh Sharma has. I must say that he's given a new, very necessary twist to the topic from the public health perspective. That's very important. We may talk great in academic setup and our own close, circle, but what about general public? And how do we serve the interests best? So core group, active group in the society itself will go a long way in helping people. Thank you so much for this opportunity. I won't take much of time. I know we have outshot the time already, and thank you for this opportunity. And congratulations to the panel for making it a very, interesting and learning experience. Thank you.
Thank you very much. So, Dr. Avdesh Sharma ji, you wanted to speak something.
Actually, I didn't want to keep coming back, but there was something which Dr. Chakhani said. I thought I must take it forward. Dr. Chakhani, you look great. Without seeing you, I can tell you that, because you have always looked great, whatever clothes you are wearing. So that's okay. It's your mind which is so sharp and powerful, and you may or may not know that you have been a teacher to a lot of mental health professionals. I would only invite, and for various reasons, last 2 years, I've been going through certain physical issues, and I've been going to various specialists, right from good friends, best of professionals, neurologists and spine specialists and orthopedics and whatever. And the beauty is that after tests after spending about 1.5 lakh on tests, we are nowhere closer to a diagnosis. I'm only making this point in one context. Step out of your clinic. Go and be with people, common people. Sit at a chai wala's shop. Watch the spiritual channels which are there, 24/7 spiritual channels. There are 24 in number at this point of time, and many others which are running from DTH. They are not even on the grid. If they are able to sustain themselves for 24 hours, 7 days a week, there must be something in that content. That is what the population believes in. Whether we like it or not, that's our problem. You know, we may say, oh, that's an alternative viewpoint. But if that is the majority of the population, that's not alternative. Like we have started saying, Ayush is alternative. Yes, but if you look at the numbers, if you look at the number of doctors, if you go into the interiors, you don't even find an RMP, but you find an Ayurvedacharya, you find a homeopath. I think the same thing will have to happen for spirituality. Spirituality is not something that we can sit here, 50 of us, every hour, talk about our principles. Spirituality is what people believe in out there. And unless we can devise ways and means of speaking in their lingo, we have missed that population. And they will come to us only for severe symptoms, which is what is happening even now. So if you want to make that shift towards prevention and promotion, I think we'll have to make the shift towards knowing what the population believes in. And once we do that, I think it would have already happened. And I would only suggest that let's talk to our younger colleagues, those who are not completely, cultured into mental health. Those people who are still learning, those people who are still interacting, those people who are still talking to their clients as one-on-one, and not as me, the professor, talking to somebody who's straight into my room and I need to give him a pill after 5 minutes. Strong words, maybe, but I think we need to wake up to that reality one day.
Thank you very much, Dr. Avdesh Sharma ji. If no one else has any comments, then I think we'll try to close the session. I think it's already late at 10:30. Thank you, Dr. Shubhangi Pakarji, the speaker, the chairpersons, Dr. Vijay Kumar and Dr. Bruno, and our advisor, Dr. Avdesh Sharma ji, Rajashri Ray, the chairperson, and the seniors who have been awake on this day, on Friday, up to 10:30. Spirituality, I mean, if we define spirituality as a journey, individual's journey towards inner self, then all aspects, that physical fitness, mental health fitness, social dimension, religious dimensions are a part of it, which can take the individual to that inner self. So as a part of this, if it can help in probably in acute, I mean, people with acute suicidal tendencies or their intentions are so severe, probably spirituality may not help at that point of time. But yes, it has definitely has a role in maintenance and preventing aspects of suicide as equivalent to as CBT, which we can equal that spirituality aspect to. So thank you very much. And I would, at this point, I would ask Dr. Praveer if he's there to say a few vote of thanks. If it is not there, Sinead would say the vote of thanks then.
Yeah, I'll finish off with the vote of thanks. Unfortunately, Praveer Bhai is just recovering from a major phase. He's doing well. He's at home now. So he has sent his apologies. Well, my heartfelt thanks to our chairpersons, Dr. Vijay Kumar and Dr. Bruno, and Madam Shubhangi Parker for the fantastic session this evening. To Dr. Avdesh Sharma, our advisor, all the seniors who joined us this evening. And really, they are very dedicated. They are always supporting. They always talk about this, even in outside the groups. And honestly, it's so motivating for us to continue this these editions. So thank you very, very much to all those who've joined. Naresh Bhai, of course, we are soulmates, soul brother, sister, whatever you call it. We don't, we always agree together even if we disagree sometimes. So thank you for being, and of course, thank you to Cipla, Impulse Division, and their fantastic technological team for giving us the continuous support. If you would like to join we have another scripture group that we have. It's an open group for all psychiatrists across the world. It's a platform where we share ideas throughout the week, and we have twice the morning sessions. So please WhatsApp me on the number 833-683-2818. You can join. We can continue the talks over there. The next session will be on the 24th of September, and Naresh plans this out as it comes just after the Dementia Day, Awareness Day, that same week. So we will focus our next session on aspects of spirituality and dementia. So till then, thank you very much. I hope I've thanked everyone. If I haven't, my apologies. Then take care. Happy Ganesh Chaturthi once again.
Yes, everyone.
You haven't thanked Dr. Rajshri.
Right.
So thank you, sir.
Yes.
So thank you very much.
Good night and goodbye.
Thank you. Tech team, you may end the show. Thank you.